Hello, my name is Dory Lewis. I am a ketamine-assisted psychotherapist. I'm also a therapist on the MDMA MAP study, on the crossover study here in Fort Collins, Colorado. I am the owner of Reflective Healing, which is a group private practice in Fort Collins where we serve the community providing affordable and sliding scale ketamine-assisted psychotherapy and soon potentially psilocybin or mushroom therapy under the new Prop 122 law. I also am the founder of Elemental Psychedelics, which is a women-led, women-run training center for the education of therapists and other medical providers in the psychedelic space. I have the privilege of getting to discuss psychedelic therapy with you today, in particular ketamine-assisted psychotherapy. So thank you for joining me. I would like to start with kind of what the process of ketamine-assisted psychotherapy really looks like in an outpatient setting. And then we'll go into some of the details around a little bit of the history of ketamine and why it's so beneficial and safe. And we'll talk a little bit about some of the rule outs, who's not a good candidate, and a little bit about integration. So when somebody comes into my practice or works with one of my therapists, what we initially do is we want to get to know the client. We want to build rapport. We want to make sure the client feels really safe in our space and in our practice. And we also want to make sure that this person is a good candidate for ketamine-assisted psychotherapy before we send them off to the prescriber who will officially prescribe them that medicine. So a client will come in, they'll reach out and say, I'm interested in ketamine-assisted psychotherapy. And initially we'll say, we can't guarantee that you're going to be a good candidate, but we'd like you to come in and meet with us for a number of sessions and see if we're a good fit for you, you're a good fit for us, and if ketamine's a good fit as well. So those first sessions are going to look a lot like psychosocials. And that means that we're getting a long history. So we want to know just basically what's going on with this person and also what's been going on with this person. So what was their childhood like? What are their relationships with family like? History of major traumas, whether that be car accidents, history of relationship with other substances. So history of addiction, history of sobriety, or whatever their use disorder is, or their current relationship with psychedelics or other substances is. Excuse my office phone. We also want to find out about their current functioning. So things like sleep, eating, exercise, relationships with friends and family, social relationships, as well as their work life. Are they able to work? Are they struggling to function on a day-to-day with these tasks such as getting up out of bed or making it to work on time? Suicidality, obviously, we're going to assess for that. And this process can take a number of sessions. This could be 2 to 3 sessions of assessing. So once somebody has gone through this process of getting to know us, of connecting with us as the therapist, and also determining if this person is a good candidate. And this is also when we will begin the referral process. So after the first session, we will send this client to one of our prescribers that we have a relationship with. A prescriber is somebody who's ketamine trained, so preferably someone who's been to a training around ketamine-assisted psychotherapy and the prescribing aspect of that, or somebody who's in supervision with somebody who's a ketamine prescriber. And then this person, the prescriber, will be also a nurse practitioner or a medical doctor. Our client will go and get assessed on the medical side. Blood pressure is a big thing that the prescribers are going to be looking for. So somebody who has a high blood pressure issues might not be a great candidate, or they might need some hypertension medication to lower that blood pressure. So ketamine and high blood pressure don't always go so well together. There are some medications that are rule outs. So things like Xanax, basically any type of sleeping medication might also have an effect. And so we're going to send them to the prescriber to find out the information when it comes to their medications. That's not our job, so we really stay in our lane as therapists. I will never say to a client who comes to see me, "Oh yes, you're definitely a good candidate for ketamine, and you're gonna get it for sure." We always want to say, "I feel comfortable doing ketamine with you, and you seem like a good candidate. I'm gonna send you to the prescriber, and they're gonna make that final determination as to whether or not you are a good candidate for ketamine-assisted psychotherapy." So it's always on the medical provider's side to determine whether or not this person truly is a good candidate. They might be a good candidate for doing therapy with me as an individual therapist, but they might not be a good candidate for CAP. So always referring them, usually after the first or second session of that psychosocial. So things that I'm looking for when I am assessing someone in that psychosocial are going to be their history of suicidality. So it's actually, ketamine is wonderful for people who are actively suicidal. In particular, though, if somebody's really actively suicidal and they're kind of in that place where they really do want to die and they're actively planning a suicide attempt, we will want to get them in for an intramuscular injection. We call them IMs, as quickly as possible, or an IV. That's going to be the most effective for somebody who's actively suicidal. What I've seen in my work is that those clients tend to respond very quickly to ketamine-assisted psychotherapy, and it usually will really walk them off the edge of that active suicidality and into more of a passive suicidal thought space, where we can do some more therapy around that and we're not in a crisis mode. So if I hear that initially, I'm usually going to want to refer them pretty fast to the prescriber because we're really looking at kind of a life-saving situation. Other things that we're looking for are anybody with a history of mania, bipolar, particularly bipolar 1, we're going to be a little cautious about. So somebody who has a history of mania, and this is full-blown mania, not hypomania, but things like having long periods of time with no sleep, having excessive spending habits that kind of go up and down in that pattern of manic and depression. We're also going to be really careful if somebody has a history of psychosis. Those kinds of things are going to be more rule outs, or the things that we're wanting to send to the prescriber. But for people in my practice, we really try not to work with folks that are in that level of potential crisis, because we are an outpatient clinic and we're not able to provide that type of 24/7 support if somebody does have a psychotic break because of the ketamine, or they are going to a major manic state. We're not going to be able to support them in the way that more of a clinic that has more 24-hour access is able to provide. So we recognize our limitations and we try not to work with clients that are on that edge of maybe not being great candidates in that sense. But if somebody has a history of hypomania, so maybe some euphoria in between their depression or some feelings of more aliveness, that's not necessarily a major rule out. We might want to name this to the prescriber and have the client name this to the prescriber, so that if that does get more intense during the ketamine series, and we'll talk more about the series in a few minutes, then we might want to start low and slow. But a bipolar 2 diagnosis, somebody who has more depressive symptoms, ketamine is going to be a really, really good fit. Somebody who has a history of addiction or is actively struggling with addiction is also a pretty good candidate for ketamine-assisted psychotherapy. And in congruence with other addiction treatment can be incredibly supportive, because a lot of people in the AA community are kind of a no substance policy. You want to be mindful that if this person is actively in a substance use program where they are very vigilant about no substance use at all, you might want to discuss this with the client, because we don't want to cut them off from their community support if they're involved in an AA program or something, and that they might get kind of excommunicated or dropped by their sponsor if they do ketamine-assisted psychotherapy. So these are things to look at. I'll also provide a resource about there are some psychedelic friendly AA organizations that are popping up in Colorado and probably all over the country that are folks who have been in the program for a number of years who are benefiting from psychedelics and wanting to kind of incorporate this into their sobriety or into their AA community. So I'll provide that to your instructor. Other things that we're looking for, rule outs, definitely, like I said, the history of psychosis. Family history of psychosis is less concerning unless that person themselves has had an active psychosis, even if they have a family member who maybe is schizophrenic. We're not necessarily going to say this isn't a good fit. So this is something that we'll continue to explore and see how it shows up in their life, if at all, through those psychosocial sessions. The other part that I look for is, what is their support? So if somebody doesn't have a lot of support, if they are really isolated, unless that they're really willing to commit to doing a lot of therapy around the ketamine-assisted psychotherapy work, meaning that they're willing to come in on multiple times a week for their ketamine session in addition to their integration session and really utilize the therapist and the therapeutic support available. It's not advised to do ketamine with somebody or any psychedelic work with somebody who is very isolated and doesn't have a lot of supports. So our hope is that that person really utilizes the support at our clinic so that they are not doing these psychedelic experiences, having kind of expansive experiences, and then not having anyone to process or discuss with. Preferably somebody, we tend to see better outcomes with people who've been in therapy for a long time. So people who understand how to use their skills, people who understand how to use body scans, people who understand how to use journaling, people understand how to use, recognize their inner dialogue. People who have been doing more internal work for longer periods of time, we tend to see a greater benefit to those people long-term for ketamine-assisted psychotherapy. So if somebody's never been to therapy, they've never really done any kind of inner directed work, they don't really understand what's happening on their inside, they don't have a lot of skills that are built for mental health support in their life, ketamine will be helpful, but in terms of integrating the information or the psychedelic experience, they might need more ketamine. And so I like to do therapy with folks for as long as possible if they're willing and if they're not in a crisis situation before we give them ketamine. Our ketamine series is as follows. So we do these prep sessions. We want to build that rapport. I like to really ideally, 2 to 3 is minimum. I like to do at least 6-8 weeks of rapport building, learning about this person and really connecting with them and making sure they feel safe with me for as long as we can. Like I said, 6 to 8 weeks is ideal. And then what we'll do is we'll do a series of 6 to 8 ketamine sessions. So those 6 to 8 ketamine sessions are going to be about 2 to 3 hours long. So this person will come for those prep sessions, they'll get that prescription, they'll bring that prescription in. They often get oral lozenges. So we're not using intramuscular injections in the office, although we have a nurse practitioner available that can do that as well as a nurse. But most of our clients are going to be using the oral lozenges, and they're made by a compounding pharmacy, usually in the area. And they will pick that prescription up just like you would any prescription, and they'll bring it into the appointment with us. We usually make an agreement that they sign that they're not going to take this medicine outside of the therapeutic environment, and their prescriber is also kind of on board with that, and they know that the agreement is that that person is going to do their ketamine with us. We have a ketamine consent form that highlights that this is the agreement that they've made with us. Now, technically, it's their prescription. They can take it at home if they want to, but we will discuss if that happens and it's not been agreed upon in the therapeutic process about what that was about, why that person chose to do it. But ultimately, this prescription does belong to the client. However, the prescribing doctor or the prescribing nurse is the one who gets to determine how that medication is used, and that can be stipulated in their prescription. And so if it is stipulated in the prescription that it says this client must take this under the supervision of a therapist, and that's the agreement that they make with their prescribing doctor, then that would also be something that they would have to explore with their prescriber if they chose to not abide by that agreement or by that prescription. So we tend to really have a good relationship with the prescriber, so that the prescriber and the therapist are constantly in communication and are keeping each other updated on what's going on with the client. So the client gets this prescription by the prescriber with the agreement that they're going to do that medicine in session with the therapist, and the therapist is in communication with that prescriber. The client will bring that medication into the therapy session. We will have previously discussed things like set and setting, ceremony, and ritual, which I'm not going to go into today. And then the client will take this medicine orally. They'll put it in their mouth. It's a lozenge. And that lozenge will sit in their mouth, and over a 15 to 20 minute period, the client will use the lozenge to build saliva and ketamine saliva in their mouth and swish it around like you would, Listerine, and it builds up in the mouth and it gets absorbed by the oral mucose veins in the cheeks. That absorption, it's maybe about 30% absorption that happens during an oral session, about 15 to 20 minutes of swishing. Some people do 12. I like to do a little bit longer. And the client will start to feel the effects of the medicine after about 10 minutes of swishing. I recommend that clients spit the solution out. So after 15, 20 minutes, we give them a cup. They spit it out into the cup, and we give them an eye mask. We put on specific music. Again, we're not going to go into the specifics around music today. And the client will lay back and have a potentially psychedelic experience. And people are often like, how? Like, why does that happen? Ketamine is an anesthetic. It's often used in hospitals, often used with children at high doses to anesthetize people. So if a kid breaks their arm and they come into the hospital and need to set it, they're going to give that kid a fair amount of ketamine, usually an intramuscular injection, so the child is kind of out of it. We also use it with horses and cats. It's a veterinary medication as well. It's incredibly safe for the body. Aside from the blood pressure situation, it really has very few side effects. The World Health Organization has considered it one of its essential drugs. It's often used in the military during surgery as well, because it has a very low side effects, and it has people are less likely to die under this anesthetic. So it's very, very safe. We use it in very, very, very low quantities, and a very small amount of it is being absorbed by this person when they do it orally. So it kind of puts people in like a dreamlike state where they're awake, but their bodies are quite heavy, and they maybe even don't feel their bodies, and they're in a kind of a sub-anesthetic state. So they're not asleep, but they're not completely awake. It's kind of like you're drunk. And it has the effect of relaxing the default mode network in the brain that's often making lists and thinking about things and kind of always running, which is great. The default mode network helps us do lots of things throughout our day what we're not even thinking about. But when we're in a ketamine experience, that quiets. So we're not making those lists, and we're not thinking about what has to happen later. And our mind relaxes. And when our mind relaxes, we have access to what I call the inner healing intelligence. We also use this term in MAPS, the MDMA therapy as well. The inner healing intelligence is a part, it's a kind of a psychospiritual term where many of us believe in the psychedelic world that there is a part of ourselves that is very wise and is a higher self almost, that really knows what we need to do in order to heal ourselves. The belief is that we all have an inner healer. So we all have what it is that we need to heal or to be, to reach our highest potential in our lives. But because of the messages that we get from society, because of our upbringing, because of our, inner critic, it's very hard to hear the inner healing intelligence. Things like ketamine, MDMA, psilocybin, these medicines really help to quiet the parts of the mind that are getting in the way of that inner healing intelligence. And they allow that wisdom to come in and be listened to by the conscious self. So I always tell clients it's like a doorway to our subconscious selves, to the part of us that is wise. And in our ketamine experiences, this is just a different doorway, different than mushrooms, different than MDMA, that opens a door to this wisdom and allows it to trickle in, and for the individual to receive the wisdom that they need to heal to the best of their ability at this point in time in their life. Does this happen for every client with ketamine? No. There are some people who go in, they don't even remember what happened, and they still actually do see the benefits on a neurological level, and many of them do well. However, there is a large percentage of people that go into these experiences and they receive healing wisdom from their inner healing intelligence. And us as therapists are there that when they come out of the experience to help them document and write that down, or to process about what came through, or to just hold space and to be there while this person is having this altered state of consciousness. And there are, like I said, some people, I would say 20% of people, maybe less, maybe more, depending on the population that you're working with, that don't really have this experience. But what they do have is a benefit. And how do we know they have this benefit? I use scales. So I use the General Anxiety Disorder Scale, the GAD, or the PHQ-9 to assess for depression and anxiety before their CAP, during their CAP, and after their CAP. And even the people who do not see the benefit in terms of the inner healing intelligence or even having any kind of psychedelic experience or altered state experience to their knowledge, we still see that their general anxiety disorder scale numbers decrease, as well as their PHQ-9. I have rarely had somebody who didn't benefit in some way, shape, or form, and I've done hundreds of ketamine sessions at this point. So we do these sessions where they come in, they do the oral lozenge swish, they change. Sometimes they're prescribed a dose range. So sometimes they're prescribed between 100 and 300 milligrams of oral lozenges. So their prescriber will recommend that they start with that 100, then they do 200, they do 300, and they find which dose works best for them. And so we have 6 to 8 sessions to kind of figure out their dose and to have them have a number of experiences so that they can really deepen into the altered state experience, as well as have the brain benefit from what's happening with the quiet of the default mode network and whatever else is going on in the brain, which, to be honest, I don't know all the dynamics that are happening on a neurological level. But I think that even though we know some, we don't know everything that's going on, but we do see a lot of folks improve. And I would say every person that I've worked with in ketamine has improved some way. I've never seen anybody get worse. I have seen people who don't like it. They don't want to do it. They don't enjoy it. They're like, this isn't the medicine for me. And we never make anybody do anything they don't want to do. If they don't want to do ketamine, they don't have to do ketamine. They have the prescription. They can throw it away or do with it, what they want, like they would with any prescription that they have in their medicine closet. So we do that for 6 to 8 sessions. Now, in between each CAP session, we're also doing an integration session. An integration session is usually within the 24 to 48 hours or 72 after their ketamine session. And what we're doing in this session is we're helping them make sense of their experience. What happened? What did you experience? Okay, great. We've been doing therapy for 6 months. You've been talking about that you have this feeling of being disconnected from nature, for example, and you don't know how to heal it. And during your journey, you had a vision of you taking a walk in the woods without your ear pods on. So we might suggest or discuss, okay, so you had this vision. You know that your intention was to build a deeper relationship with nature. Let's discuss what changes you're going to make in your life to support this vision. Now, that was a very specific example. I'll think about a case study. So I had a woman who had a lot of anxiety about health. So constantly always worried about her health. She did have a number of health problems that were mostly stress related. And so it was hard to know which came first, the chicken or the egg. Were the health problems causing her stress, or was her stress causing the health problems? It was hard to know. She was overall, high functioning in terms of being able to go to school and go to work and in a healthy relationship with her partner and her husband, but also really struggled with these feelings of stress and anxiety. So during one of her ketamine sessions, when she was in the experience, her inner healing intelligence shared with her that she was missing joy, that her life was really absent of joy. And it came through very strongly. She was able to see herself as a child in a vision, and she saw the joyfulness that she had as a child, and she recognized the vacancy of that energy in her life now. So during our integration sessions, what we discussed was, how do you integrate joy in your life? And so we spent a number of sessions exploring, what does joy mean to you? How do you know that you're feeling joy? Tell me about times that you have been in joy. When was the last time you can remember feeling joyful? There are people around you. Are there people around you that you see as joyful? What do they do? How do you know? And then we started to practice, okay, so I want you to try to blow bubbles for 10 minutes on Sunday and tell me what happens. Journal about it. Write about what came up for you. And we tried this. We tried skipping. We tried blowing bubbles. We practiced, watching comedy movies, lots of different things. And she was documenting through this process, and we would integrate this information over time until eventually she found that there were certain things that really brought her joy. And then it became the challenge of putting those things in her schedule as a priority. And so that became part of our integration process. And over time, as she integrated more joy in her life and made more space for joy, her stress levels reduced. And she really did better in terms of her health outcomes as well. So this is just an integration of how we utilized ketamine to then integrate the information to make changes in her life. And that's the goal. It's not to make sure that people are doing ketamine for the rest of their lives. I mean, for some people that is essential, and it's few and far between. I would say maybe 5-10% of people might need to do regular ketamine sessions if they have seasonal affective disorder, which is very good with ketamine. But ultimately what we want to do is we want to help people integrate the necessary changes in their lives that their inner healing intelligence shares with them in their psychedelic experience, so that they can ultimately make changes and improve their lives in a way that is sustainable and that uses behavior changes or thought changes to really support this. And ketamine does provide a little extra oomph in that direction. So it does help people who are kind of stuck. I mean, I've been a therapist for over 10 years. And yeah, clients usually know that exercising, eating well, having healthy relationship with friends, not overusing substances makes them feel better. But the motivation to actually make those changes is usually hard to find. With ketamine, we have a window of time, because we're doing this for 6 to 8 weeks, where their motivation is greatly improved. If we can make those changes in that 6, 8, even 10 weeks after their last session and really push to make those changes, they are more likely to stick. And we do have a little bit more motivation from the person because of the ketamine. So that's really a sweet spot for us. That's why integration is so important, and holding clients accountable for the changes that they're going to make in their ketamine practice is important. This is also why I want people who have been in therapy for a while to do psychedelic work, because they're more likely to understand that, yes, psychedelics are great, but psychedelics themselves are not going to make somebody's life different. Ultimately, individuals are going to have to make their lives different by changing their behaviors and changing their mindsets. And using the motivation given to us by psychedelics is great, but if they don't stick with it, it's not, the psychedelic experience is just a peak experience that's going to remain in the past, and they're going to need to keep using it over and over and over again. However, if they integrate their experiences and they truly make changes in their lives, then their lives start to transform, and their lives start to look more and more like their psychedelic experiences, until eventually we start living our lives like our ceremonies, like our rituals, like our journeys. And taking that information and really shifting the way that we live our lives. And that, I believe, is one of the most beneficial aspects of psychedelic work. It's not so that somebody can have these peak experiences, but it's so that people can learn from the psychedelics, like their teachers. And the teachers are our own healing wisdom that's inside, giving us access to those teachers so that we know what is the special sauce for me in my life that I need. Because for some people it's smoothies and yoga, and for some people it's rock climbing and dancing, and for some people it's, who knows? It's you know, I don't know. Yeah, hiking and kayaking, or yeah, there's so many different ways for us to heal, and we all have our unique special sauce for what healing looks like for us. It's to find that and to integrate that. And that's what ketamine can do. That's what psilocybin can do. That's what MDMA can do. Well, MDMA is a little different. We won't go into that today. It also has some major chemical effects in the brain, which is usually what it is that helps reduce the suicidal thoughts and ideation for folks. And that is, I think, with the default mode network of the part of the brain that's kind of going and going and going and circling, kind of OCD types of thinking. That tends to be reduced with ketamine short term, but it won't be long term. So there are some folks, like I said, who will be doing ketamine regularly, and for many people, that's better than taking, an antidepressant that doesn't work every day. And the great thing about ketamine is that you can still take your antidepressants with ketamine, so it doesn't impede on somebody's ability to have a full ketamine experience. Somebody can be on an SSRI and take ketamine because ketamine works on dopamine in the brain, and it doesn't work on serotonin. So that's one of the major benefits of ketamine as well. So I think what would be helpful is for those of you who are interested in doing psychedelic work is to have psychedelic experiences with ketamine and a therapist. One of the things about my training program and when I teach therapists is that I want them to experience ketamine. And this is often a component of ketamine-assisted psychotherapy programs, is to have an experience with ketamine. It's required in my program that somebody sit with this medicine a number of times before recommending it to others. And this is because when we're psychedelic therapists, we really need to understand this terrain. We need to be able to speak the language of these medicines, to be able to describe what might happen. And if somebody's having a tough experience, which can happen, ketamine can be a little scary sometimes. Some clients might feel really uncomfortable. We want to be able to hold space for those challenges and understand that this person is going through what they need to. And if you've been through psychedelic experiences and you've had challenging times, you might know that when you come out of it and you come out the other side, there was a benefit to that challenge. There was a reason why you had to go through it. And we can hold that space for clients much better if we ourselves understand what that challenge is like and how essential it might be for our own healing. So doing your own work with therapy and with other psychedelics, or particularly with ketamine in this instance, is a beneficial way to learn about ketamine-assisted psychotherapy. So there's many other components that I'm not going to go into. Set and setting, ritual and ceremony, the specific music, touch and the limitations around touch, therapist ethics. These are all major components of ketamine-assisted psychotherapy, which are going to be important to learn. But this was just a general overview of what a ketamine-assisted psychotherapy process might look like from beginning to end. And there really isn't an end. I work with clients for years after their CAP experiences to help integrate. And we usually finish integrating maybe a year after their first CAP session. And many of my clients no longer come back to therapy during that time because they've really integrated, and I want them to practice their skills that they learned. They're always welcome to come back, but many of my clients are in a stage in therapy where maybe they're coming every 6 months. Maybe they're coming just to check in and make sure that, they're continuing their work. But many of my CAP clients who had started a few years ago are at a place where they've integrated their skills and they're living their lives in a much healthier and a much more balanced way. So I've seen great benefits, and luckily my practice is a place where we support people throughout the whole process of CAP. It's not just come in, do a prep session and do your CAP and then don't come back anymore. We really want to support people on a medicine journey of what psychedelics can do for someone's life over time. And that's my belief, is that using ritual and ceremony, using integration, and using deep therapeutic rapport building are the key building blocks to long-term benefits of psychedelic therapy, as opposed to more short-term benefits of psychedelic therapy for people having kind of peak experiences and then not really integrating their experiences and not having a therapeutic relationship with their counselor. So I hope that this was supportive and helpful. If you have any questions, please ask Ivy. She can give you my information, and you can check me out at elementalpsychedelics.com if you want to attend one of my trainings, and reflectivehealing.com if you're interested in learning more about ketamine-assisted psychotherapy. I hope you have a great rest of your day.